Good morning, friends. Today we will discuss the first remedy of Phatak Materia Medica, that is Abies Canadensis. For each and every remedy we will study on that day or on while listening this session, you all need to have a book with you, that is Phatak Materia Medica. For the reference, why you need this book? Because if you have book in front of you, there is you can see the references from the book, and then you will listen what I can teach. So it will easy to remember you in both way, that is visual memory and audio visual memory. So you can see from book some sentences or their meaning and hear what I am saying in the session. So let us begin with Abies Canadensis, a small remedy, organ remedy, basically organ remedy for the stomach or the patient of the modern day eras with some peculiar symptoms and closely related to one or two more constitutional remedies. So in Phatak Materia Medica, it's given in detail about this remedy in a few sentences. So mainly the remedy affects on the mucous membrane, nerves, digestive organs, digestive system, and female genital organs. Phatak places this remedy among the nutritional and nervous debility states, where the digestion is weak but appetite is excessive. This is not a dramatic remedy, it is a quite under recognized OPD remedy. So the essence or personality of this remedy is some peculiar 3 or 4 things that you should remember, and that's it for that remedy. So increased desire with decreased capacity means patient eats more and digests less. Patient eats more, he has ravenous appetite, he eats more but digests late, he has distension, wants activity but lacks the strength. The patient is internally exhausted, not lazy, like a calcaria. Mental and emotionally, Phatak describes it's very in simple one sentence, easily fruitful or quiet and careless. Clinically, this means that this is mild irritability, gets annoyed easily but withdraws, careless, indifferent attitude, no strong fears and anxiety. In OPD, commonly patient says that doctor, I don't know why I feel like this, just I feel drained or I feel exhausted. This mental tiredness is due to a poor nutrition or a nervous weakness. Then the physical generals in day-to-day OPD, what we say that we see that nervous weakness, feels fainting, wants to lie down frequently. This is a true weakness, not a rest-seeking behavior. There is some hysterical patient or some female patient especially behaves like he is too much weakness and wants to rest. It is a true weakness. Appetite and craving is the more important aspects, that it's more actions on stomach. Ravenous appetite. Craving for coarse food. Coarse food means patient craves more coarse food, pickle, radish, turnip. Patient eats beyond the digestive capacity. Patient eats beyond the digestive capacity. Hunger is increased due to catarrhal stomach condition, not health. Means he is not eating more because of his catarrhal condition of the stomach. Mainly as a clinical diagnosis is in peptic ulcer, patient have ravenous appetite or increased appetite but digestion is poor. You can think of this remedy in gastric or peptic ulcer. The clinical hint that more hunger, more distension, more weakness. Think of Abies. This triad helps us to prescribe Abies Canadensis in day-to-day practice. Uh, Due to the distension, patient has typical symptoms that lies with leg drawn upwards, means he's both lies with legs drawn upwards, suggests that abdominal discomfort and debility. So with that you can give observe this remedy patient while examining, or patient tells that I am feels better when I feel my legs is drawn up. So these symptoms may get more characteristic while prescribing. Keynotes of this Abies Canadensis is distension of abdomen, as I already told us, and stomach, palpitation after eating, fullness and bloating. It's tried when hunger, distension, weakness, and these abdominal symptoms gives us that he is nutritionally deficient, or his digestion is weak, or stomach catarrhal condition, or upper GI irritation or catarrhal condition. Peculiar sensation, Phatak very specifically tells is that right lung feels hard and small, liver feels hard and small, uterus feels soft and feeble. These are peculiar sensation you may find. These three sensation, that lung, liver and uterus feel hard and soft, that indicates that his connective tissue or tissue of the organs, muscles have lost tissue tone. So you can be see that tissue tone of that patient. Then female symptoms, you may see that sore feeling in uterus, better by pressure, uterine displacement due to debility. These are more few female symptoms with uterus feels soft and feeble. In modern day-to-day diagnostic, you may say that functional dyspepsia, chronic gastritis, malabsorption status, or maybe early anemia may be find you in investigations of this patient, or maybe you may find gastric ulcer or peptic ulcer. Some of the closest remedy of Abies Canadensis is mostly you can see the distension and hunger is that lycopodium. Both have common symptoms of bloating, distension, gastric complaints. But differentiation is that lycopodium has ego issue, fear of failure, desire for sweets. Abies Canadensis has careless, weak, nutritionally exhausted. These are differentiating point. When ego issues or confidence issue dominates, you can think of lycopodium. When weakness dominates, you can think of Abies. In lycopodium, you can have 4 to 8 ppm aggravation, or in lycopodium you feels few mouthfuls may give satiety of that ravenous appetite. So these are the some differencing point. Then another closest remedy may I will in my day-to-day practice I can give few doses of Abies Canadensis in early first prescription in lower potency 6 or 30, and then if the constitution is feels like lycopodium, then one or two doses of lycopodium 1 m or 10 m. It will mostly alleviate all gastric symptoms of that patient. Then another is differentiating remedy is Calcarea carbonica. Both have common features of weak digestion, fatigue, but Calcarea have more anxiety, obesity, chilliness, desire for eggs, while Abies Canadensis have ravenous appetite, debility and indifference. You can mostly differentiate that Abies is hungry, weak and careless. Calcarea is anxious, obese and chilly, desire for eggs. In another one remedy with the gastric or distension, we commonly think of China. So China and Abies Canadensis has both have common symptoms of weakness, debility and bloating, distension. But China is morely of due to loss of fluid, due to blood loss or due to severe anemia, or hemorrhage, or due to weakness after fever conditions. while the Abies has excessive appetite, poor assimilation and catarrh of stomach, more desire for pickle, radish and turnip or coarse things. We can in one or two words that China has loss related weakness, means that he has a loss of fluid due to diarrhea, vomiting or excessive bleeding due to piles or menstrual complaints. China is indicated, or in post fever or post viral weaknesses, while Abies has a nutritional weakness or indigestion related weakness. Then another remedy is one of the common remedy with we can think of differentiating with Abies canadensis is pulsatilla. Pulsatilla and both have digestive disturbances, but pulsatilla is emotional, weeping, seeks sympathy, while Abies canadensis is quite indifferent, withdrawn. Uh, or pulsatilla is more emotional dependency have pulsatilla, but in Abies canadensis emotional indifference is more we can see. So prescribing totality that I can tell you in few 4 or 5 symptoms that we must think of is ravenous appetite, distension after eating, craving for coarse food, weakness and desire for lie down, especially when lying down he pulls his legs upward, mild fruitfulness or careless attitude, female pelvic weakness with soft uterus. So these 5 to 6 symptoms are make core of this remedy. When hunger is loud but strength is silent, means that patient has ravenous appetite but patient is weak. The common mistakes we do while prescribing the Abies canadensis is when only hunger. So you can correlate the hunger as it is due to stress, as it is due to diabetes, or he is exercising, or his activity is more, and then his hunger is increased. So we should differentiate the why he is hungry. While asking 1 or 2 questions, we can get understand. Always confirm weakness, poor assimilation, and coarse food craving with this hunger. So we can summarize the Abies canadensis in few 2 or 3 words that ravenous appetite, distended abdomen, distension after eating, and weakness. In Abies canadensis reminds us hunger does not always mean health. Means that if we feel hungry, then we can say that is healthy person. But these are the triad while we can use while prescribing a day-to-day OPD. Due to that hunger issue, the main gastric complaints are back of that hunger issue. So these are the commonly seen how Abies canadensis we can see. The potency part of this remedy. If we can give in lower potency 6 or 30, I am using 6 or 30, or in some cases 0/1, and in old age patient, or I have to strengthen the stomach and above symptoms are there, patient is hungry but distension is there, may I am using mother tincture 5 drops a night. So these are the my clinical experiences regarding the Abies canadensis. So hopefully we will join in next session. Thank you for peaceful listening. Thank you.